This Town Hall webinar is being broadcast live on Akaku Channel 53, streamed to Facebook Live at Kelly King Maui County Council Facebook page, and also here on Zoom. The theme of today's COVID-19 presentations can be summed up as what is happening, what is not happening, and what should be happening. The pandemic is real, folks, and we need to coordinate our efforts so that we can make Maui safe again. I have been contacted by many in the public who don't understand the decisions that are being made or why, or in many cases don't know what the rules are. And because the situation changes daily, we hope that tonight's events will shed light on where we are today, how and why decisions are being made, and how concerned citizens might get involved in solving the issues and situations for which we have become the watchdogs. I want to welcome our panelists today. We have with us Steve O'Neill, who is a former UN disaster response lead and private citizen residing on Kauai with 3 young children. He has been working informally with a number of doctors, former civic leaders, and others engaged in improving the state's COVID response. In the last few months, he has written a number of opinion pieces for local news outlets. And I might also add that the numbers on Kauai have been extremely low, and we want to thank Steve for coming and sharing his mana'o with Maui County as well. Since September 2020, Dr. Michael Shea has been the Chief Medical Director of Maui Health, a not-for-profit organization which operates Maui Memorial Medical Center, Kula Hospital, Kula Clinic, and Lanai Community Hospital. Dr. Shea is an intensive care physician and has been co-incident commander of Maui Health's Emergency Operations Center since May of 2020. He also served as chief of staff at Maui Memorial Center in 2018 and 2019. With us today also is Maui County Managing Director Sandy Boz. Thank you for being here, and thank you to the mayor for allowing you to be here, Mr. Boz. And we have council members Gabe Johnson, who holds the county council seat for the Lanai residency area, council member Shane Sinensi, who holds the county council seat for the East Maui residency area, and county council vice chair, council member Kiani Rollins-Fernandez, who will be with us. She holds the council seat for Molokai, and she will be with us in video. She couldn't be here in person. We also have Lisa Darcy, who is the founder of Share Your Mana, a 501c3 dedicated to community education and the health and wellness of those living unhoused and unsheltered. Lisa has 30 years of experience working on all levels of social services and also is a Buddhist chaplaincy student. And last but not least, we have State Representative Tina Weilberger, who represents District 11, which includes Kihei, Wailea, and McKenna. So thank you for being with us. She's now serving her 2nd term. I want to thank all of our panelists for participating today in this town hall. Please remember to mute your microphones when you're not speaking. Questions from the public will be taken via Zoom only. So if you're on this Zoom channel, we will be monitoring the Q&A section. To join the Zoom webinar, use the meeting code 982-4433-4389. A direct link to the Zoom meeting is also posted on my Facebook page, Kelly King Maui County Council. For those in Zoom who wish to ask a question, please use the Q&A function in the toolbar at the bottom of the application to type in a question. Questions will be monitored by staff and myself and posed to the panelists to answer on air. Reminder to all panelists that any of you may add a response to the public's question if you have information to share, and we encourage dialogue. If viewers are exchanging information via chat, it will probably not be included in the Q&A. And again, the meeting code is 982-4433-4389. A direct link to the Zoom meeting posted on my Facebook page. This meeting will be recorded for future viewing. So before we get started, I just wanted to go through a little bit of background on where we are today. Today, we in Maui County, our statistics taken from the State Department of Health website, our 7-day average daily new cases is 35. Our test positivity is 3.3%. Our 7-day average daily new cases per 1,000 is 20.9 compared to 1 month ago, December 11th, where our 7-day average daily new cases per 100,000 was 8. We have so far a total of 1,441 cases and 18 deaths in Maui County. And the new cases just over the last week went from 21 on January 5th up to a high of 56 on January 7th, and today there were 33 positives. The Harbor Lights complex has a total number, as of today, of positive cases at 92. And also wanted to note that last Thursday, Lieutenant Governor Josh Green called for Hawaii residents to avoid all social gatherings for 2 weeks immediately, as a number of new confirmed COVID-19 cases hit a record high for the new year. Hawaii had 322 new coronavirus infections reported on Thursday alone, the highest since mid-August, when the number spiked to 355. Resolutions urging the mayor to establish a rapid COVID-19 task force was unanimously voted on by the county council. And at this point, the mayor declined to establish the task force that we called for, but I'm very happy that the administration is participating in today's panel discussion. Also of note is a law that was recently passed in the state of California by the California State Assembly. Bill 685 requires that employers, public and private, effective January 1st, must notify employees within 1 business day of learning of any potential COVID-19 exposure. It must also offer them information on benefits such as workers' compensation and sick leave, on protection against retaliation, and on the company's virus safety measures. So that was adopted at the end of last year and is got into effect by the California Division of Occupational Health and Safety, Cal OSHA. So that's just a little bit of background of where we're at and why we're holding this meeting. There's a lot of folks who have been asking a lot of questions and also have a lot of stories to share. And so I'm hoping we can shed some light on, like I said, what is happening, what isn't happening, and what should be happening. And we're going to go ahead and open up with a presentation by Stephen O'Neill. And if there's anything else you'd like to add to your bio, please feel free. I think if we gave bios on everybody on this panel, we would take a half an hour. So, I'm just really happy that you're all here and highly qualified to talk about the items that I've asked you to discuss. So Mr. O'Neill is going to talk about Maui's situation relative to other islands and suggestions to decrease spread and bend the curve down. And this is coming from his direct experience advising the mayor in the county of Kauai. Okay, take it away, Steve. You want to unmute yourself? Oh, hello. Excellent. Okay, there we go. Gotcha.
Well, thank you, everybody. And I should say that I haven't been part of any sort of formal advisory group to the mayor. I've been part of a group that I think it started with our former mayor on Kauai, Joanne Yukamura, publishing something in the Garden Island or maybe in the Star Advertiser. And a number of people then just reached out to her, other doctors on Kauai and also on other islands and other citizens. And when I published something or submitted something actually about the risk of community spread on Hawaii and Maui back in August, when I think you guys were cutting it a little bit close. She reached out to me, and as did some of the others. And so I've been part of an informal group of about 15, at times it gets up to about 30 people coming on and off, that are just really into understanding the science and having a really collaborative, open discussion with lots of actual disagreement and trying to see both sides of things or all sides of things, and slowly getting to generally a consensus about what it would take to really respond well to the virus. And it's been really a privilege and amazing experience for me to work with such a, sort of selfless and yet sharp and, collaborative group. And I think that is the best thing that, that's sort of the culture that needs to get created within the leadership and with everything anyone's trying to do around anything difficult, but particularly around this COVID response. So I just want to say, I think because of our ability to work well together. The mayor, we did occasionally submit things to the mayor, and some people knew the current mayor, and he would read our stuff. And I think that, we're very lucky on Kauai. I think we have a very well-informed mayor who does follow the science and try to really understand what's going on. He also has a really good district health officer who is very strong and also very collaborative. So I'm just somebody who's been part of a conversation. I guess it's good that I'm going first because I'm not nearly as qualified as Dr. Shea and others that are really on the front line. But I have put a lot of time into really trying to understand what's going on here. I have 3 kids to try to understand whether to put them into school or not. I do have my experience working in kind of disaster situations with the UN and learn something from that. But mainly, someone said that I can read, think, and apply logic, and I do try to do that. And I just put more time in maybe than some others. So I'm also recognize that I can be wrong, and so I will feel pleased if anyone corrects anything that I have to offer. I'd hope to put together a full presentation that I will continue to work on and actually submit that can get sent around to the community. But for now, I'm going to pull from it just kind of on my own screen. And if I see a screen worth sharing, I will let you know. And I'll start with, I think also why you may have reached out to me, because I was reaching out to people in Maui and saying, all of my data is showing that you guys are in trouble. And I will do a screen share right now, and I will try not to be overly dramatic, but I do think it's good to sort of recognize a problem. Can everybody see this screen share right now fairly easily? You are in Maui's in its 3rd surge. So you have this first surge you can see. Are you able to see my mouse moving around? No problem.
Steve, can you slideshow mode so it's bigger for everybody?
Slideshow mode. Yes. Thank you. Present.
Thank
so,
you.
The thumbnail, yeah.
Okay. So that's exactly the kind of feedback I appreciate. Thank you. So this first surge was what happened when the virus came along. And then you have the second surge in August, which coincided with the whole, with all the islands pretty much. And actually, I would say with the exception of Kauai. And then you had ourselves opening to travel. And that's where Maui's 3rd surge began. And that started actually really, this is the Lanai bump. And then this really is this sort of steady curve. It started far before the holidays. So I think I've been hearing that there's a concern that this surge is really because of the holidays. It's possible, and I would imagine they would contribute to it. But it started before that, and I think that's important to recognize. Same thing happened in California. Their big jump started before Thanksgiving. And so the natural course of this virus is to spread and when possible, spread somewhat exponentially. So I think that I'm worried if there's too much of a faith that this will just naturally start to settle down after the holidays. So I hope that I hope that we're careful there. So my slideshow is not in perfect order, so I might be jumping back and forth to get in and out of my slideshow here, but I will show you something that I think is also interesting to see. You have, again, here's our opening, and here's where the new cases are coming from. What you see here is in blue are your travel associated stuff. So what you didn't have in this previous surge right here in the summer was a lot of travel associated cases. But what you do have now is a good number. It's this sort of low lying, percolating contribution to the total count. And that concerns me because in all the studies that we looked at in New Zealand and everywhere, it starts with what they call patient 0. And certainly that's how Lanai started. I doubt it was 2 or 3 people bringing it in. Maybe it was, but they probably would have been the same group. It was one person, and that one person very quickly spreads it to a lot of other people. So this is what is continuing. And I think we should be concerned about that and recognize that perhaps the safe travels still should be somewhat modified. I'm going to point out sort of why here. Sorry. Okay. I'm going to stop my share for a second. So one of the, wouldn't you know it? Okay, let's see if I can reload that. Okay. Again, my apologies for not having this really ready to roll. It's just, this was an unforeseen thing today. Okay, so one of the, and I will go back to presenting my screen with everybody.
While you're doing that, Steve, I just want to let people know too that our next presenter, Dr. Shea, will be discussing vaccines. So if you have any questions, you might want to wait till his presentation and ask them if they don't get answered.
That's great. And I won't actually talk much about that. I won't talk really at all about the vaccination, although I think that is really one of our greatest hopes to get that done as quickly as possible. One of the things that we notice is that when the Safe Travels program began, we started with kind of an understanding that for every two travelers, for every traveling resident, there were two visitors that were coming, and that's true on Oahu, but it's actually not true on Maui. On Maui, for every traveling resident, you have roughly 8 visitors. On Kauai, we had up to 15 or 16 visitors for every single resident that traveled. And that, I think, is something to also pay attention to. And you'll see why this is important in a minute as well, I hope. But this is the number of people that are coming onto any of these islands every day. And you can see with Maui, it's roughly 2,000 visitors for 278 returning residents. And then if you take your friends and relatives and put them into the visitor off-island category, you have an 8-to-1 ratio, which is quite high. Let's see what happens on Kauai back on November 15th. Yeah, we had a 15-to-1 ratio, which was quite high. So something I want to sort of show is that the islands are extremely different. Maui has 12% of the population of the state, yet it receives 36% of the visitors, and about 13% of the traveling residents on all islands are from Maui. Oahu has 69% of the population, but receives only 47% of the visitors, and 74% of the traveling residents are actually on Oahu. So there's some legislation I've been reading about that might try to have all islands be essentially treated the same, and I think that would be a really unwise thing to do. And so, yeah, let me see if I can back up.
Can you either turn your volume up or maybe speak a little bit closer to the mic? There's some people that can't hear.
Sure. Yeah. Okay. And so what I was going to show here was we've been hearing for the last really up until just recently that the Safe Travels is working, and this is a statewide cases, and this is when we opened, and it's more or less a flat curve. But what you see is that that's not when you look at any island individually. So in this case, certainly Maui doesn't have a flat curve. It has a directly straight up curve. So I think one of the points I'd like to make is let's be sure that each island retains the ability to act independently, because their situations are extremely different. Completely different profile of travelers versus returning residents, completely different set of curves. Only if you look at everything from 30,000 feet, do you actually think that, oh, it's really not that big a deal? It's quite a big deal on Maui, and I know you guys all know that. And so I've pointed that out. Now, community spread could decline, I think, if we stop seeding the community with so many new cases. And again, Oahu gets 2 visitors for every traveling resident. Maui gets 8. Kauai was receiving 16. And that's why our mayor said, yeah, this isn't going to work, because it was clear that they were bringing in quite a bit. Kauai had quite clean data. We started with no community spread and essentially no cases. 20% of the resident travelers would take a second test, but we saw that only 2% of the visitors would take a second test. And that's because obviously if they turn positive, they can't fly back. Their whole family can't fly back. They likely have to go into isolation. So I think it's important to recognize that visitors generally are not going to volunteer to test. And even if they're feeling a little bit sick, they're generally going to, I would think a good number might choose to not test and just go home. So that's, I think, something pretty important to recognize. And then also recognizing that while resident travelers act differently when they're back on island, they go back and home and live with their families that often have extended, family members living with them. They're not more likely to get COVID when they're off island. There's no evidence that would show that people that are from or live in Hawaii are more likely to catch COVID in California. So that's important to know, but and to recognize that they're 10 times more likely residents to be tested, and visitors are 10 times less likely to be tested. We also learned from a study in Alaska that more than 8 times the number of the people that were in the hospital from COVID living in Alaska, the highest group by 8 times the average were Pacific Islanders. And so there's clearly a propensity to get especially sick among that community from this virus. And then I guess lastly on this piece here about the safe travels, and I'll give you some more positive things, but I just want to establish this. We had a surveillance study that you may all have heard of. It was to be a 60-day study where 10% of the travelers would receive a PCR test on day 4 after arrival. And it became 10% of the travelers would receive an email inviting a test, of which a very tiny percent responded. And they didn't email the other 90%. They just kept it at that 10%. The prediction was that 1 out of 1,000 travelers would get through the pre-flight test. That 60-day study was cut short by 2 weeks. They added 19,000 same day of arrival antigen tests done on Hawaii, which dramatically skewed the overall results. An antigen test is not as sensitive as a PCR test, and testing on the same day that you arrive is not as likely to pick up the virus as testing 4 or 5 days later. So that was quite I think no real medical study would be able to look at that and say that that surveillance test program was appropriate, because it violated the basic methodology. But there was a press release issued saying that it was okay, and things are working out fine. If you dive into the data, you saw that 2,500 PCR tests were done on Maui, Oahu, and Kauai. Again, you couldn't tell what happened on Hawaii Island because of the antigen tests. There were 18 positives, and that's 1 out of 139 travelers were missed by the pre-flight test. And that's 7 out of 1,000 travelers, not 1 out of 1,000. So 7 times what was predicted. And this was all begun back in October, when California was averaging 33,000 new cases a day, and now we're averaging 40,000 new cases a day. So I personally feel that there's a very high likelihood that what's contributing to Maui's surge is the fact that you guys get a disproportionate number of tourists by a long shot, by far more than any of the other islands at this point. 4 times as many as Oahu, with a fraction of the population and the medical depth, beds and things like that. So I would be quite worried about that, and I would continue to reevaluate whether you feel this is an appropriate strategy going forward. There has been no place on the planet that has been able to open with a single pre-flight test and not have a serious surge, whether that was Alaska or Tahiti. The Bahamas opened and closed multiple times trying to figure out how to do it. And it always resulted in a surge if you had simply a single pre-flight test. I think that we have noticed that visitors do stay somewhat away from resident populations, or resident populations perhaps stay away from them to some degree, and that's actually working in our benefit. But they still, one way or the other, end up seeding the community, and I think that is a serious risk. What has been shown over and over again is that if you test somebody 3 days or 4 days after they are infected, you will generally not pick up with any test that they have the virus. It's because you catch this virus and it replicates, and it takes time for the viral load to become high enough to detect. On day one, I think it's 100% are missed. On day two, you might get 1%. Could be picked up. On day three, it's 3 or 4%. Day four, it drops down to 35%. You might be able to pick up. Day 8 tends to be the best day, where you might get 70 or 80% of the actual cases would be picked up by the test. So, the science, I think, is really clear. The only way to really have an airtight, somewhat airtight program is to have a second test with a small quarantine in between. Our recommendation was a 7-day quarantine. Our group's recommendation, I would say, somewhat collectively, was a 7-day quarantine with an exit test on day 7 to get out on day 8. Until that's really done, I think you're just going to continue to be bringing cases in, and have to recognize that you're doing it from a part of the country that was doing quite well this summer. California was, people were looking at California as really being able to have managed this well, but even they, it spikes, and it has over time, as we've seen. It's now the worst in the country. I think they have 100 cases per 100,000, and that's quite a high active cases that they detect. There's of course, that's always what they detect is just the tip of the iceberg. There's always many more below under detection. Certainly, all the asymptomatic people. So I think something that we should recognize is that Maui has essentially started on October 15th with 1% of Hawaii's cases, and Oahu had 89%. Now on January 10th, last night when I was putting this together, Maui's up to 18% of Hawaii's cases. Again, with a very small portion of the population, and Oahu has dropped to 74%. And that is because, in my mind, essentially Maui is carrying a exceptionally high load of the tourism industry. And I can't really say that people in Maui are acting all that differently than people on Oahu. And so I think one should really look at that and say, do you really want to allow this to continue? That's a big spike. That's not really appropriate in my mind. So hopefully that's helpful. I can give you some thoughts I just did about what to do.
Steve, I just wanted to maybe go through and see if there were some questions. We're getting a lot of questions, but some of them are for later on. So I can kind of go through and ask you. These are, but maybe more productive use of time to let Dr. Shea go, and then our managing director go, and then I can just ask the questions, and the three of you can chime in, depending on which ones pertain to your presentation. Are you okay with that?
Yeah, I think that's fine. I think the only thing I'd like to add at some point is just to talk about some steps where you could, one blind spot we see is actually around the school openings. And so at any point, you just let me know when.
Okay, I think when we get to Representative Wildberger, she's going to talk a little bit about the school opening. So hopefully you can give us your mana'o again at that point. And so right now we'll turn it over to Dr. Shea, and if you can fill us in on what's happening with our medical facilities and with the vaccinations.
Absolutely. Thank you, Councilmember King. Thanks for inviting me on the panel tonight, Steve. Great presentation. Very interesting. I always appreciate data, so thank you for that. I was going to start with vaccines. I will get to an update on our medical center, but vaccines seem to be what people are most interested in right now. And I agree. I'm very excited about this. Vaccines are a game changer. Thinking back to when we started all this back in March, April, when we were just hearing about coronavirus and seeing it for the first time on the island, I remember thinking the only way that we're going to get through this is immunity. We need immunity. And there's only two ways to get immunity: one, to get the virus, and two, to be vaccinated against it. So I think all of us would prefer to be vaccinated rather than get it. So having the vaccine finally here is very exciting from a healthcare worker standpoint and as a scientist. So currently, as many of you know, I'm going to go through background just to make sure everyone's on the same page. We have two vaccines that are currently under emergency use authorization from the FDA. There's a vaccine from Pfizer and a vaccine from Moderna. There are other vaccines in the pipeline. They have not yet been evaluated by the FDA. Both these vaccines are what are called mRNA or messenger RNA vaccines. So how does that work? Messenger RNA is something that we already have in our bodies. It is essentially the plans to build proteins. So the vaccine uses technology that we actually inject these pre-made plans for one of the proteins called the spike protein on the outside of the virus. It is not part of the infectious virus, which is the genius of this. So you cannot get the virus from the vaccine. It's not a live attenuated or killed vaccine. It is simply the instruction book to build protein. So the instruction book is coated with a layer of what's called lipid, which is the building block for fats. It allows it to get inside the cell. And then the instruction book is taken by the apparatus in the cell that builds proteins, and the proteins are made. Your immune system sees them and says, those don't belong, those are foreign. And it creates antibodies, stimulates the immune system to attack the protein. And then ultimately your immune system will remember that protein. So if it sees it again, it will be ready to fight and hopefully prevent infection. So important points, it cannot enter the nucleus of a cell where our DNA is. So it cannot alter our DNA. I know that's one thing that I've seen out there people are concerned about. It cannot attack your genetic material. The other things I've heard, it does not increase the risk of HIV. It's sort of an interesting factoid. One of the early vaccines that was started early in 2020 had a component of the HIV virus in it. It was not the intact HIV virus, but folks who had been tested with that vaccine apparently were testing positive for HIV because of that genetic material. So that has now engendered a myth that if you get the COVID vaccine, you will be at risk for HIV. That is not true. And then, of course, people have said it causes sterility. It does not. And my favorite one out there is people have said there might be microchips embedded in it. There are no microchips in the vaccine. We pay hundreds of dollars to carry phones around with us that have those very microchips, so there's no need for them to install them into our vaccines. So do not worry. Both vaccines are a two-shot series. Pfizer is separated by 21 days. Moderna is separated by 28. It doesn't need to be exactly on that day, but they do prefer you're as close to that day as possible. And if you're not going to be on that day, they suggest you be a day or two late as opposed to early. The CDC has a vaccination tier system that they have set up for any pandemic, which we are using for the coronavirus pandemic. Currently, we are vaccinating in tier 1. And within tier 1, there are subgroups, A, B, and C. So you can find this. There's a nice document out there that Hawaii DOH put out on December 30th, which breaks down those various tiers. Tier 1A is healthcare workers and long-term care residents. So those are the folks we've been working through over the last few weeks. Vaccine first arrived on Maui on Christmas week. We did our first doses at Maui Health on the 23rd. So we spent the last 3 weeks trying to get through Tier 1A. In addition, the federal government did contracts with CVS, Longs, and Walgreens to do the residents of long-term care facilities. So I know that Kula Hospital got their vaccine yesterday, and we went over and helped out on Lanai a couple weeks ago. I think it was the 30th. So all of those areas for Maui Health have been covered. DOH has also been trying to take care of and doing a good job of taking care of the community healthcare members. They're most of the way through them. We did lend a hand and reach out to any of the stragglers they weren't able to pick up, got vaccine into them last week. And so we are starting to move on now to Tier 1B, which includes all Hawaii residents over the age of 75 and any frontline essential workers. So that can be a somewhat broad category. And if you look at the CDC website, it admits that some of the lines between these tiers can be a little bit blurry when you go from essential frontline workers to sort of really important frontline workers, like people who work at grocery stores and all of those, as opposed to the first responders that have already been vaccinated. So we have been asked by the both State Department of Health, Dr. Libby Char, and Hilton Rathel, who is the CEO of the Healthcare Association of Hawaii, to be very aggressive in our efforts to vaccinate as many people as we can. And so over the weekend, starting on Friday afternoon, we did open up to Kapuna over 75 and frontline essential workers. So right now, our rate is dependent on our ability to get vaccine. The vaccine supply lines have been more delayed from the feds than initially anticipated. And so I think we may not ramp up as quickly as we would like, but I can tell you we're being very aggressive in getting vaccine for Maui. We're beginning second shots this week for Pfizer vaccine. We're doing Pfizer vaccine at Maui Health currently because we were able to borrow a ultra cold freezer, which goes below minus 70 degrees from UH Maui College. They were very kind in lending it to us. County Department of Health does not have doesn't have one in their facility, so they are using Moderna, which does not require the ultra cold, but can work in a regular freezer. So each of us, Maui County Department of Health and Maui Health, are running our own independent vaccine clinics to try to cover as many people as we can. We are in contact frequently, and we're helping each other out whenever we can. And of course, in regular contact with state DOH, and I have a weekly call with the CMOs at all the hospitals to make sure that the resources that are needed are being shared appropriately. I'm just trying to see if there's any other details. Let me go to my notes here. So that's really it for vaccines. I'm going to skip over now for a little update on Maui Health and Maui Memorial. So a little bit about surge capacity. So as Steve pointed out, we are in the midst of the early stages of our third surge. We've been very fortunate. The COVID positive patients that we have had in-house have not been very sick. We are currently at 7 COVID positive patients in-house. 2 of those are on ventilators. So again, right now, we're doing fine from a capacity standpoint. But with our numbers going up, we would not be surprised if our hospitalization numbers match that in the coming weeks. Hospitalization often is delayed anywhere from 10 to 14 days after patients seroconvert to positive on their tests. So a lot of times, trying to anticipate needs can be very challenging because when someone is exposed, as Steve pointed out, it can take, we see 5 days typically from exposure to when people are turning positive on the PCRs. We are using a very sensitive PCR assay. So certainly the 5 to 8 day range is common, and then people may not develop significant symptoms or require hospitalization for up to 2 weeks after that. So the effect on the healthcare community is somewhat delayed, and so you do have to try to predict. We are licensed for 219 beds, but our surge plan allows capacity for 300. We have 31 ICU beds, 16 of which currently are used for non-COVID care. And then the other 15 beds are where we have our warm unit, which is where we take care of all levels of COVID care, critical care down to regular medical care. And it allows us to take care of both COVID positive patients and patients who are under investigation for COVID, who have clinically suspicious symptoms or an exposure history that is suggestive while they're waiting for test results. And oftentimes we'll test them more than once for the reasons that Steve gave. Sometimes if you catch them early in their course, the test may be falsely negative because their viral load is not high enough to detect at that point. I know folks are always very concerned about ventilators because running out of ventilators early on in the pandemic was a big concern. That was what we were seeing in Italy. We went out and purchased 20 additional ventilators, so we are up to 42 state-of-the-art ventilators. In addition, we have 6 BiPAP machines, which can be converted to do ventilation, and we have a dozen bridge ventilators, which were constructed by one of the engineering firms on Maui. So at this point, we have capacity for 60, and the county has at least 30 other bridge ventilators in storage. So at this point for our population, we are doing very well for ventilators. If we needed 60 or 90 ventilators, we'd have a lot of other big problems to be worrying about. So we're very comfortable with that. Just as a note to give you context, in the last year, we have not had any more than 15 ventilators in operation at the same time, including COVID and non-COVID patients. So again, we're doing pretty well from that standpoint. We have all the beds, IV pumps, equipment, and staff necessary to take care of 300 patients should we need to. I want to talk a little bit about testing. It's often another hot topic. So we do PCR testing using a machine called a Panther here at the hospital. The machine tests turnaround 6. The machine has a capacity of about 1,000 tests per day. Important to note, though, that a lot of that is rate limited based on how much time technicians have. So staff is often doing other lab work, blood work, things like that. So we do about 500 tests per day at this point, which has been more than enough to serve the needs of the hospital and the community. We test all hospital admissions on admission on day 3 of admission and day 6 of admission. Again, referencing the data that Steve was talking about, because patients can be incubating. We want to make sure we catch any admission who might have been early in their incubation phase. And that's regardless of symptoms. That's any patient who comes in through the emergency room. And we have seen patients test negative day 1, day 3, and pop positive on day 6. So it has been very valuable to continue the serial testing. We test all outpatient surgery patients as well as selected invasive procedures within 72 hours of their procedure, again, to minimize any risk of having someone go into the operating room, undergo high-risk aerosol generating procedures, and not expose staff in the hospital unnecessarily to COVID. Also, any inpatient having those procedures who hasn't already been tested in the last 72 hours gets tested. We also test our staff regularly. When COVID numbers were low, we were testing approximately 10% of our staff weekly and trying to do a smattering of all the departments. So we were getting samples from all the departments. Recently, with the increase in numbers in the community, we've done a point prevalence study, which we had done previously over the summer during the second surge. And to date, we've been very fortunate. We have not found any positive staff through our point prevalence study. So that pretty much tells you where we are at, and I will stop there and leave it open for questions.
Okay, thank you so much, Dr. Shea. We're going to go right into a presentation by our Managing Director, Sandy Boz, and then I'll start going through. We have about I think it's about 50-ish or so questions in the Q&A box, but some of them are repeat. So I'll try to go through them quickly when we get to them. But right now, we'll hear from our County of Maui Managing Director, Sandy Boz. Thank you for being here, Sandy.
Aloha, Councilmember King. Good evening, everyone. So, you've heard a lot already this evening, but I did want to talk to you. I guess the request was for information about testing from the county, and so I want to let you know our programs. We have 2 programs that the county is paying for. Originally, it was CARES Act money, and now we're paying for it out of county funds that we had set aside. And thank you, council members, for being proactive last year during the budget session and allowing us the support of extra money. We have a community testing, which is done 6 days a week throughout 3 different areas of Maui County. People can schedule, register online or call in and be able to go to get tested. You don't have to have any insurance. You don't have to have any symptoms. You just go get tested for free. The results actually come back. We use a Abbott PCR test for the community one, and it's about So I got my results in about 30 minutes. I drove to Kihei, took the test. By the time I got back to Wailuku, I had the results in an email. But it's a pretty quick test.
I'm sorry to interrupt you, but just real quickly, does that one qualify for travel?
No, it does not. The two programs that the county is supporting financially do not qualify for the actual travel test. They're not a Safe Travels trusted partner. Minute Medical, who is our contractor, does have a separate test that they do for pre-travel. So you can go to them or go to many of the different providers have pre-travel tests that are available. So we started that program on October 18th. Between October 18th and I think yesterday, we have provided about 14,500 tests to our community, and then also to the voluntary second test program that we have for travelers. And out of that, I should have written down the number from today, but I think we had 310 positives out of that whole 15,000 that we've been doing. The breakdown is for the last couple of weeks has been about 80% community spread. 17% was travel-related residents, and 2% was travel-related visitors. And so you can see that issue with those testings. We do utilize that program to do specific testing. Tomorrow we're going to be in Hana doing testing in the Hana area. So people in Hana, if you're listening, go on to minitmed.com and click on the pre-register for COVID-19 test, and you can register for tomorrow. If you're anywhere else in Maui, you can register. Again, we have Kahului, South Maui, and West Maui sites that are available 2 days a week in each different area. So it's a total of 6 days a week that they're open. So that's a lot of testing, way more than percentage-wise than other counties have been doing, specifically as a community test. The Big Island did a lot of testing, of course, as far as the travel. So they have a program where when you land, you get tested. It's an antigen test. That is, they're trying to test as many people as they can. Their goal is 100% of travelers coming in from trans-Pacific flights, but I don't think they're at that point yet. So it kind of skews their numbers as well. These are people that had pre-travel testing negatives, and so when they land, usually it's, as you've heard, if there is a virus inside them, it hasn't incubated enough to spread. But so testing is pretty robust. You see the numbers fluctuate as far as the test positivity rate because they're you may have a bunch of tests done a few days before, and the tests come back positive the next day or 2 days later when the Department of Health recognizes them, and the number of tests on that day had been maybe less or something like that. But you can see that's why we're looking at either the 1 week rolling average or the 2 week rolling average, and it's much higher than we would like for sure. Same with the new case counts. So I did want to talk a little bit about Mr. O'Neill's presentation. He mentioned that we had our spike in October, right around the opening of the state to the pre-travel testing program. So just for your information, he may not be aware because he's from Kauai, but that case it started off with a healthcare worker on Lanai and ended up to be 106 cases. So that spike that we saw in October was specifically a healthcare worker that went into Lanai positive, shared it there, and then it got shared throughout the community. So that's a challenge. We have another set of cases that are going to be coming out from Lanai as well. Now there was a friend visiting a resident of Lanai, and that friend ended up testing positive when they went back home and infected people on Lanai as well. For the cases on Maui recently, we had over 150 cases between Harbor Lights and some of the Pacific Islander. If they saw something, they're not Polynesians. These are Pacific Islanders, generally from the Pofa consolidated federal agencies like Micronesia that are here. A lot of times, unfortunately, they're living in very tight living situations. We had incidents at Harbor Lights where we had 10, 12 people in a single bedroom apartment living there, and the cramped living quarters. We need to really work on them. There's a bunch of support services we're providing to Harbor Lights as well, but I can get into that in a little bit. So when you look at our case counts, yes, we have had more. Yes, there are some definitely related to travel, but it is skewed a little bit when you look at the actual numbers of cases that are here. So what we do when we're analyzing what rules to change and what to discuss, we of course discuss it with our medical people here. Dr. Shea is one of them. We contact regularly. I think the mayor calls him almost daily, probably to get updates and information. Dr. Pang is a very valuable resource for us. We have other doctors, other professionals that have been watching this and following with us as well, that we contact and get a little bit of advice from each one and try to figure out what the best solution is. We look at the cluster reports, which are available on the Department of Health's website, and I encourage everyone who's out there, if you're wondering where these cases are coming from, that cluster report is a valuable tool. It's put out by the Department of Health. It's what we trust to share with us where these clusters are coming from and how we can address them. That along with our own testing and tracing programs. So when we look at that, that's how we analyze what responses are required. When we started seeing the surge in cluster for our community spread, we proposed a rule to the governor, which he approved, to reduce the gathering size from 10 to 5 for social gatherings. And what we've been actually telling people is, please don't gather. Don't socialize with people outside of your household. It's really one of the key factors of spreading the vaccine. Hotels and restaurants and bars are also, people are sitting there eating, drinking without their masks on, talking story for a long period of time in an enclosed area. So that was one of the other areas that was a cluster. So we reduced the capacity. We had reduced it to 50% throughout this pandemic, and now it's at 30% for indoor gathering. People can eat outside, no problem, and they can, people can serve. We have different rules allowed now. If a restaurant wants to expand outside, there's a lot less red tape for them to expand outside. They do have to get a liquor permit if they're going to be able to serve liquor outside, but definitely makes it easier for the restaurants to counteract having to close a lot of their inside operations. So we try to balance out everything we're doing with, if it's going to hurt, how can we reduce the hurt a little bit? But we verbally are telling people it's up to you. Please don't, spread by going to a lot of gatherings. And, it's unfortunate, but, we can't control people at their own households. We can't be in everybody's house, going there, counting heads and saying, are you from this household or not? So, government can only do so much, but it's really up to our citizens to help us to reduce the spread. As far as enforcement goes, though, we do have a stepped-up enforcement program. The mayor has authorized additional overtime for our police department to go out and do actual, more mask enforcement, different things like that. We are working on another program. The more of you out there helping us with mask enforcement, the better. Definitely, you can help us remind people nicely, please. We don't want to have any fights or anything, but please just remind people, hey, this is Maui. We do have a requirement that you wear a mask outside as long as you're going to be within, possibility of within 6 feet of somebody else. And, we want you to make sure that you're wearing your masks and have that in place. And let's see, we try to get the message out as much as possible. Our website has some great information on it. If you go to mauicounty.gov, We have the rules are always on there very prominently. One of the first things on there, how to travel, different restrictions, things like that. And we have, of course, the mayor's office has a phone number to call, 270-7855. You can get, most of the time they have the question, they have the answer. If they know it, they'll share it with you. Of course, there are some things that are not county issues or county understanding that we try to share as much information, but the state website, which is hawaiicovid19.com, is really, really great. It has a lot of data on there. They have a lot of different charts. This is where you can find things like the cluster reports and things like that. A lot of Department of Health data, as well as travel data, all that information, as well as then frequently asked questions and how to prevent spread and how to gather with safely, things like that. So just working on that. So Member King, that's pretty much my basic information, and I can answer questions as we get through.
Thank you for that, Director Boz. And I'm going to try to start going through some of these, and I'll just try to direct them to the presenter that I think it's directed to. And the first one, you just talked about masks, is like, how can we make it clear to the public that you have to, if you can't distance yourself 6 feet, you have to wear a mask? And, areas where people are congregating or walking on the same pathway, a lot of times since it's outside, you don't see people wearing masks. So what can the county do to help enforce that, especially around the hotels and near the beaches?
Sure. So, we do, of course, have our Maui Police Department out there, and they are the ones that are allowed to issue citations if you are not wearing a mask. And so they're helping us do mask enforcement. One of the things that they do is, they'll tell people first, hey, you need to wear a mask. And they'll ask, do you have a mask? If you don't, they actually have a stock of masks that they'll give to people. And so, generally, like if they see a homeless person on the side of the road, they don't have a mask, we would pass them, give them a mask versus giving them a citation. Very, very rarely would we give anybody like that a citation. But those that are blatantly not wearing masks, we actually arrested somebody who it's a business owner that was told to wear a mask, multiple times, refused, and then we had to actually arrest them. So we're doing the best that we can. We really need everybody's help to share and spread the word. And if you can help us, that'd be wonderful. We have asked businesses, in fact, it's part of our rules, the businesses have to put up signage that masks are required. So when you go into a business, you'll see that right away, that masks are required, different things like that. And
something that the general public can do too, to kind of police those areas around the hotels that should have signage up that maybe don't.
Yes.
So thank you for that. And then just going into, we have a few questions about the vaccine. So Dr. Shea, somebody wanted to know if they could get vaccinated the same day without an appointment, or you must have an appointment, is what I thought I heard earlier.
Right now, we're doing appointments only, and that's mainly because we're still ramping up capacity, and there's more demand than supply right now, and that's a federal problem, not a Maui problem. We are working with our state leadership to try to aggressively get more vaccine. As more vaccine becomes available, Maui Health is committed to opening up sites around the island. We are currently looking at Kihei. We've talked with Tina Wilberger about helping us find a place. We're looking west side and then maybe upcountry. And I know DOH is also going to be active in this process as well. So for right now, please, we're not doing walk-ins, just by appointment only. And we're using our website as the link to get registered if you qualify as Kapuna 75 years or older, and or essential worker. Thanks.
Okay. And then the other, there are a couple other questions that are related. One is as a caregiver for somebody who's over 75, can you get vaccinated? And somebody want to know when, if pre-existing conditions would qualify them for a vaccine, even if they're under 75.
So right now, unfortunately, caregivers of folks over 75 do not qualify. And I understand the question. It's a good question. And I think the CDC has just tried to draw reasonable lines as well as they can. Folks with pre-existing conditions will be the next tier. And again, I'd love to give you a timeline on that, but it really is dependent on how quickly we can get more vaccine. So.
Okay, so we're hoping that what we've heard from the new administration is they're going to start opening up the floodgates on providing the vaccine rather than holding back for the second dose. Let's see, okay, I'm not sure who, maybe Director Boz can answer this question. Please explain what travel associated means. Residents working in tourism-related businesses are exposed to travelers. So are they classified as travel associated?
Yeah, so when the Department of Health does contact tracing on a positive case, they'll try to get to the root of where that person got it from. And if it was a hotel worker that got it from a traveler, then that should be identified in the contact tracing that Department of Health does. What generally is travel related is, a visitor or resident comes here and takes a test here and is positive. That's direct travel related, or that person, then spread it to a close contact, and so that close contact would then be travel related as well. So it's not just people that have traveled; it's the travelers who share, for lack of a better term, the virus with others.
Okay, so if you're working in the travel industry or the tourism industry and you get it, you will be considered travel related?
It really depends on the contact tracers at the state and how they have a lot of series of questions and investigation tools that they utilize. Member King, if you don't mind, I do want to make a small pitch, or not a small pitch, a large pitch, please, for everybody to download the Aloha Safe Alert application. It's contact tracing that is available on everybody's cell phones that has either Android or Apple. For Apple people, it's on your cell phone already, and all you need to do is either enable it or disable it. You don't necessarily need to download this Aloha Safe Alert application itself. Michelle's showing it off. Thank you, Michelle.
I've downloaded it. It's really simple and it doesn't give names out.
Yeah, no, it's very confidential information. What it does is it anonymously talks to other phones around you. If you've been close to somebody for within 6 feet for more than 15 minutes within the last 2 weeks, what happens is if that person ends up testing positive, they're given a code that they enter into their phone, and then everybody's phone who had talked to that will get notified through this Google Apple alert notice system. And it's the benefit of this is that it crosses different states as well, right? It's because it's the certified one that the Department of Health has utilized. The base data talks to other Google GAIN, we call it for short term GAIN, applications that other states. So if a visitor comes from Colorado or California and they have it downloaded for their state's version, then when they come to Maui and they're interacting with people, it doesn't need to be the exact same application, but it needs to be one that's certified by their Department of Health. Only one application is allowed per state, and so the State Department of Health did choose the Aloha Safe Alert. If you go to alohasafe.org, they got a lot of good information about there, and then you can go to your either Apple Store or Google Play Store and download it. I have 2 phones, so I have it on both of my phones, just in case I'm separated for anything. Dr. Peng did do a test of it, and it does notify us. We also know from the developers that they've issued, there's been, I forget how many downloads, but when Maui was the only county that was advertising it, and they had a total of about 12,000 downloads. We don't know obviously who exactly downloaded it, because that's confidential information that government shouldn't have anyway. But we do know there was about 12,000 downloads when just Maui County. Now they've started to advertise it statewide, and so there's more people participating in it. Okay. But they did have positive cases of people who utilize the application, and so it does. What it does is it will notify you. In fact, if you look at your phone every once in a while, mine buzzes and says checking exposure, and so it does check every once in a while, and it'll let you know if you've been exposed, and it'll tell you the instructions of what to do. Isolate, go get tested, things like that. So,
Okay.
please, everybody, download that application.
Get it every few hours too, so it kind of re-updates.
Yeah.
This question is for, I think it's for Steve. It's somebody who's asking about looking at your surge data. It's hard to compare counties because we don't know if the same kind of testing is happening in each county. So maybe between you and Director Boz, do you know if it's comparable, those figures, when we're looking across the board at the different counties? What are your thoughts on that, Steve?
Well, I think Director Boz is probably going to know better. And I want to say I appreciate your clarification, and I can see that Maui has somebody really working hard. I know all of you guys are working so hard, so I really appreciate your observations and sharing and corrections. And so, yeah, I mean, I think I'll leave it to you. My understanding is mostly we use PCR on Kauai, and we are there are, for some of the sort of post-visitor testing or post-traveling resident testing, they have an antigen test. I believe here there's a sense of, generally follow that up if it's necessary with a PCR test, if you do get one. So it's useful, but they tend to follow them up with PCR. Is that your understanding?
Yeah, so a couple of things. We do antigen test over here, and then we do follow it up if it's positive with a PCR. And that's something that really makes a difference when we're looking at the positivity rate as well, because you're now taking people that are selected as most likely positive and then testing them with a PCR, and that gets counted. So the negative antigen test doesn't get counted in the calculation, but the positive PCR test does. And so you see that that's a big difference. I do want to mention, so Kauai County, as of I think yesterday, these numbers had done 25,417 tests since the start of the tracking of this pandemic, and Maui County has done 85,411. So it is kind of hard to compare the two counties. Populations are different, travel is different. I think we're the only one in the state that has the free testing for anybody that is not symptomatic. So that's something that really is a benefit to our community, that we have that available and really try to dig through and find the cases. So yeah, I hope that answered the question.
Okay, great. Thank you. There were several questions about the difference in testing types, so I think you covered a lot of ground there. And I have a question. I'm not sure who this is for. How do you feel about a primary test pre-travel and a secondary fast-acting test upon arrival? Anybody want to?
I'll take a stab at that, if you don't mind.
Okay.
So, because the Big Island does that right now. They have an antigen test upon arrival. You still have to participate in the state's pre-travel testing program. If you don't, then of course you're just going to go straight into 10-day quarantine. We talked to Dr. Peng about that, and he was against that, and for scientific reasons. If you think about it, somebody just got a test within 72 hours of flying to Maui. That test was negative, and so if you land on Maui, that's within 72 hours. You're going to test again within 72 hours of that original test. As we've learned from Dr. Shea and others, the incubation period is 5 days or so on average. And so doing a test right at the airport isn't very beneficial. Before the state opened up, Mayor Victorino did request the governor to allow us to do a second test 72 hours after arrival with a quarantine. And so what the request was is somebody would take a pre-travel test, have to be negative. They land here, they have to quarantine in their hotel for 3 days. Then they get tested, and if they test negative, they're free to go. The governor did deny that request, and so he basically gave us no other option except for to accept that single test that the lieutenant governor's been pushing, a single test prior to is great, is what he keeps telling. But we would really be more comfortable with a secondary test a few days after arrival, with that time period in between the first test and second test.
Okay, so Steve, wasn't that something that the mayor on Kauai, he opted out and then was allowed to do that second test? Or am I?
Just first listening to Mr. Baz, I'm really heartened to see what you guys are trying to do, and hats off. For the idea of having free testing, first of all, is actually a really significant, great thing as far as we could tell. We would love to see that on Kauai. You guys are way ahead of everybody with that, and that is how you ferret things out. And so, good job. And I think that recognizing, as Dr. Peng and everyone else did, I think I may have come across as sort of anti-visitor, anti-travel, but I'm really trying to support, and so is everybody else that I'm aware of, a second test. And so, that is what you guys were also trying for. And so I'm pro-travel, I'm pro-opening, because we need to get people back to work. I just think that to do it without a second test seems unwise. And so our mayor also had that observation and conclusion, and he was shut down as well and said, no, you cannot have that second test. So what he did was he opted out completely. Not sure if that was really going to work, as far as I can tell. I don't want to speak for him. And then reintroduced the ability to have a bubble with a second test, but it's become quite complicated. So I think everybody is struggling with that. Certainly now it's obvious to me on Maui as well. You guys are really struggling with that. And I think there was a moment of solidarity between almost all the mayors where they were going to really push there. I'm sure it was very disheartening to see that not quite happen. And I know, I would guess, you'll certainly have all of our support to help you in any way we can.
Okay,
thank you
for that. Let's see, just real quickly, it seems like a large increase, a part of our increase in numbers recently is coming from local residents, far more than visitor arrivals. And the person who asked this wanted to know, if you take Harbor Lights out of the mix, what does that do to our numbers? Maybe Sandy, can you?
I'd have to go back and analyze that specifically, but like I mentioned, between Harbor Lights and other Pacific Islanders that were, close contacts of that cluster, that was 150 cases over the last, couple of weeks. So if you take that out, that's a pretty significant number. We're still obviously have double digits. We're still going to have way more cases than we would really, really want, but that does skew numbers quite a bit.
Okay. Thank you for that. And here's one that I think has been on a lot of people's minds for Dr. Shea. Has it been proven that having the COVID-19 makes one immune to getting it again? So
It's an excellent question. They are reporting, science is reporting there are sporadic cases where people can get reinfected with COVID, but it is very, very rare. It's like many viruses. We don't yet know what the long-term implications of this is going to be. Is it going to be like the flu, where you can get a different variant next year? But right now, it's a very, very rare occurrence. And I think I saw some other questions around, like the vaccine itself. How effective does it make us immune? And again, all vaccines, the idea is to introduce your body to the exposure without getting the disease. So no vaccine is perfect. This doesn't mean you get to run around without a mask and that you are impervious to COVID. What this means is it reduces your risk of catching it. It certainly reduces your risk significantly of having severe disease if you were to get COVID. So I thank you for giving me the opportunity to really make the point. We still need to wear masks. We still need to be smart about not gathering in large numbers. And really, as Director Boz is saying, right now, don't gather at all. And maintain social distancing and gently remind your friends and neighbors to do the same. Thanks.
Okay, thank you, Dr. Shea. And then somebody wanted to know if you could discuss VAMs. There seems to be an issue that allows people to sign up outside of their group and out of the state to make an appointment and get a vaccine in Hawaii.
So VAMS, let me give you the quick primer on VAMS. VAMS stands for Vaccine Administration Management System. It's a government program. That's why the acronym, they love acronyms in the government. So what it is actually a fairly ingenious system that allows nationwide everyone to log people into. So we input emails for people. And then the VAM systems reaches out via your email to get your demographics, so they stay private. And then once you've registered, allows you an opportunity to make an appointment. The downside to VAMS is that whoever puts your email in can't specify which site you're supposed to come to. So if it asks you, like, look for a site within how many miles of where you live. So if I put 200 miles, I could get my vaccine on Kauai. I could go to Big Island. I can go to Oahu. So it's created some confusion because here on Maui, we have two sites. We have the Maui Health site and we have the Department of Health site. So we've been very careful to, in our instructions, say, please select our site. The other tricky thing is that VAMS will only let you schedule as many appointments as doses of vaccine you have on site, because the supply chain is actually integrated into VAMS. So if we have, say, 1,000 doses of vaccine, we can only make 1,000 appointments in VAMS. And I can tell you, when we opened up on Friday to get people in 1A and 1B, we've had over 7,000 people request. So do the math. We have more than 6,000 people that we can't give an appointment to. And I suspect some of them looked at DOH and said, oh, they have appointments, and booked there. So we're going to continue aggressive communication to let people know, please, if your intent is to register with us, please register with us and leave the DOH spaces for who DOH is trying to target. And I've seen Dr. Pang is on this. So Lauren, I'm sorry if we inconvenienced you today with that. It was an innocent mistake, not intentional. Thanks.
Thank you, Dr. Shade. And also, Dr. Pang stated in the chat that if you remove the Harbor Lights numbers, our numbers are half. So that answers the question about what happens with those numbers. I wanted to next, if you folks can hang on, because we have so many questions, but a lot of them are repeat questions. But I wanted to give our other panelists a chance to just give us some insight into what's happening in our isolated communities. And starting with Councilmember Gabe Johnson, who is from Lanai, and we've heard some of what's been happening on Lanai, but just if you could just let us know what's happening over there, where you guys are at, and any outstanding experiences that you've had.
Okay, sure. Thank you, Councilmember Kelly King, and thank you all, great panelists. I've learned a lot. I'll talk a little bit from the Lanai perspective, and some of it's already known, but I just figured I'd share some of the basics. From October 20th until November 11th, we had an outbreak that jumped up to 106 cases on the island of Lanai. And I think there's a lot to learn from that, how it just spiked. We had a 2 week to about a 30-day shutdown, and then about 3 week shutdown, and then boom, it went away. And I guess according to Director Boz, it did come back. That's the first I heard of it. And then I think the thing that I learned was, okay, when it comes in, and it comes in hard and it comes in fast. So we got to be really kind of strict on ourselves, and I think that's what the COVID lockdown did to our community. For Lanai, we're country as can be, and a lot of the things that we do for leisure, it can kind of help us. We all go hunting and fishing, and we do things in a lot of solo activity. We don't have a big restaurant scene. We have small restaurants, and we don't really have any bar scenes, so we didn't really get that. And I think it allowed us to have a little bit more of a better mental health, as far as like we can go to the beach and just be, kind of self-isolate. So I think the one thing that I learned, as far as the capacity to accept, that was really a big deal that I learned is, everybody from Maui, oh my gosh, Lanai is the last island to get COVID, and we were really hoping they wouldn't get it. And so then all of these donations came by ferry, by plane, and we had on Lanai, on our side, we had to figure out how we're going to deliver it to the people who were in quarantine and how to, so on our side, the capacity wasn't really there to deliver all of the major donations from Maui and off island. And I think now you see Harbor Lights is kind of going through that. We're like, there's a lot of people who want to help. And then, how do we go and deliver these foods, our breakfast, lunch, dinner to the people in quarantine? So overall, I think the food drives are a great success on Lanai, and you can see throughout the islands, food drives have been really keeping people healthy, keeping some farmers employed, and eating healthy. So I know that when we lose our jobs, we cut costs on our diet, and if the farmers are being funded by COVID money, I like that kind of economic cycle where COVID money goes right into the hands of the people who need it the most, and then now all of a sudden the kapunas, they can wait in line and get some fresh vegetables and make good meals out of it. So I think those are a lot of the things that we learned for Lanai is the capacity to deal with an emergency. We got to be ready to accept it on our end. And also the food drives have been a great success, I think. So that's where I'm coming from, the island of Lanai. Mahalo.
All right. Mahalo, Councilmember Gabe Johnson. And can't wait to get started working with you, our newest member. Next, we'll move on to Councilmember Shane Sinensi from the very isolated Hana. A little bit of reverb there if everybody could mute. I just want to point out too that Hana had zero for a very long time and was closed off. So maybe you can share some of that experience with us, council member, and how it is since you've opened up travel into Hana. Need to unmute. Okay, there we go.
Hello, can you hear me?
Yep, I can hear you now.
Thank you, council member, for having this virtual town hall. For us as, sorry, let me put down my, as you mentioned earlier, yes, we did have a closure of the Hana Highway at the very beginning of the pandemic, but since the beginning, we've our community has unified. Our Hana District Council Office has been actively supporting all the efforts relating to COVID testing, hosting the test teams, and setting up test sites here in the Hana community. Our community quickly organized under the East Maui Ready team. And through the Hana Business Council, the community is constantly updated on all information on a regular basis. Community education and information updates are a priority for the team. Education and guidelines for health and safety protocols is a priority and is updated and disseminated regularly. East Maui Ready is notified of any positive cases in East Maui. We had a couple, but nothing that was within larger family households. They used the HIPAA guidelines, the Department of Health, Hana Community Health Center, East Maui Clinic, the Mayor's Office, MEMA Office, the Hana Police, Hana Fire, and a host of volunteers attend the weekly meetings. There've also been regular updates on hours of operation for local businesses, food distribution opportunities, testing opportunities, and positive case occurrences. And they also encourage the use of the Aloha Safe Alert app. We also have the East Maui Kupuna Hui, and they're focused on response efforts on building a community-wide network to ensure that every kupuna is connected to a trusted advocate, and essential information and resources could be both gathered and shared as needed. The place-based approach is essential for our rural communities from Kaupo to Kenai, as each place has unique challenges and strengths that has been impacted differently by the pandemic. We also have the Ala Kukui Retreat Center. East Maui has established a quarantine area if needed, with plans for supporting the needs of those quarantined. And like Councilmember Johnson said, the Hana Farmers Market has been a huge success and a hub for food distribution within the community. The market takes place each Friday afternoon, and their online hub projects with products can be prepaid and picked up at the market. So that's just a quick synopsis of how our community have joined together and looked out for everyone's safety. Mahalo for having me tonight.
Okay, mahalo, Councilmember Sinanti. Really appreciate that report. We have a report from Councilwoman Rollins Fernandez, which was videotaped, but I'm going to go next to one of our other isolated communities. Lisa Darcy has been patiently waiting, the first one here. And I really appreciate you being here, Lisa. She has done a lot of work with the homeless and the unsheltered, which I consider to be a non-contiguous isolated community throughout our county. So Lisa, maybe you can give us a few words about what's happening in that community and in and among, and I know you recently posted something about finally getting some attention from street medicine, so maybe you could tell us what that is as well. You need to unmute yourself.
You get so involved, you forget to do things like that. Hi, good evening, everyone. My name is Lisa Darcy, and I'm the founder of Share Your Mana, which was established and incorporated as a nonprofit at the end of 2017. At that time, I worked tirelessly to build relationships with individuals that were living unsheltered to really understand how they were experiencing working with agencies, surviving with minimal resources. And I'd like to invite everyone in the audience to just maybe close your eyes for a second, and just for a moment, and to think about how you would handle this pandemic if you didn't have a home or an apartment or a car. Think about it if you were living out of a tent or out of a car, or even just you didn't even have those resources. And when this pandemic hit, many people really depended upon the routines of an open community, with businesses running, with transportation running, with agencies functioning. And when the pandemic hit and everything shuttered, they went into actually a humanitarian crisis. And they were struggling for food and for water, and they were not able, many people for up to weeks on end didn't even know what was happening because of the digital divide, because they couldn't go to Starbucks and use the Wi-Fi, which is always so generously afforded. They couldn't get food from tourists that usually leave food after they leave. And they were extraordinarily isolated and confused. Their first concern was not the pandemic. Their first concern was, how am I going to get water today? How am I going to use the bathroom when the park's closed? They had no use of bathroom facilities or water. And their lives went into complete and utter chaos. The Maui Homeless Alliance shuttered for weeks on end, months, and nobody was reaching out. The flip side is that there were many community members who wanted to get involved and to support. And that's the whole foundation of Share Your Mana, is to harness the community members that are able to step up, even in crises such as this. And what Share Your Mana has seen is that there has been enormous inaction on the side of our agencies in our county. While they try to figure out what to do, these individuals are left day to day in a deep struggle to actually just survive. And I have been able to make some observations. And one is that there are different sets of rules for people who are housed and unhoused. And there seems to be an application of, if you're unhoused, there is a vulnerability into getting citations. The sweeps were continuing, and I still know of people that are being displaced. So their CDC guidelines were not respected for individuals who are living unhoused, and this continued to move people around and still does. People's cars are still getting towed when they're living out of them. These kinds of actions are really painful and detrimental to the safety of this community. And we will continue to advocate for the sweeps to stop. We will continue to advocate for ways to digitally connect people who don't have data and don't have Wi-Fi, and whose, agencies are still not running at any capacity that can meet the need. One of the things that has just recently happened is Share Your Mana has gotten connected with Malami Ikeola's street medicine team, which has been active for, it sounds like a year or so. And this type of collaboration, which even today just helped an individual get into a doctor's appointment today through multiple texts and calls, through getting a taxi to where they live and getting the taxi to wait. And these kinds of collaborations are what is going to keep this community safe. I'm still really not sure what anyone who is homeless or houseless or unsheltered, I'm still not sure what the protocol is if they're sick. And there really hasn't, from anything that I've studied and all the meetings that I've followed over the last 8-9 months, it still is unclear where they can go, where they can shelter in place. So it still feels like there's enormous confusion if you are an individual living in these conditions. So I just want to say thank you for the opportunity to be able to advocate, certainly for individuals, just even some of our basic human rights tonight, and to engage the community in safe ways to support when agencies and when we don't really have a response from our administration. So thank you.
Thank you so much, Lisa. I really appreciate all the work you're doing there, and certainly stay safe yourself. I'm sure. Are you on the app?
Not yet. I have to tell you, this is the longest I've gone without being sick in recent history, because I love wearing a mask. I love bleaching down my car and using sanitizer. It's actually, honestly, it's the longest I've gone. And I think Share Your Mana has been engaged every single day since shelter in place and before shelter in place in some capacity. So yeah, we're doing what we need to do to keep wellness checks every day, I hand out masks every day and sanitizer. Yeah, we're doing all we can do.
Excellent. Thank you so much. Did you have a question, Tina?
I wanted to mention to Lisa that someone is asking how they can contribute to help the homeless situation. So please share your website and any information for people to contribute.
Is it shareyourmana.org?
Yes.
Shareyourmana.org. Thank you for that, Representative Wildberger. Let's see. We have a video. Is that queued up? Axel from on Molokai. Okay, this is Member Rollins Fernandez, who couldn't be with us live on this meeting, but had videotaped a little report of what's happening on Molokai.
Aloha, I'm Council Vice Chair Kiani Rollins Fernandez, Council Member for the Molokai Residency Area. Mahalo for allowing me this time to provide an update from the Molokai community. This pandemic has been very devastating for our Maui County community, health-wise, and most especially financially. For those who have either lost their employment completely or have had their income reduced as a result of COVID. Molokai is unique from the other islands in our county that rely more heavily upon tourism, in that businesses here rely mostly on residential customer traffic. Due to that fact, Molokai was not impacted as hard financially as the other islands were. As a close-knit community, we would normally get together a lot, and we're very physically affectionate, greeting each other with kisses and hugs. The ability to not carry out our cultural norms this way has probably been one of the greatest impacts to Molokai. as it can be harmful to a community's mental and emotional health. The Molokai food distribution effort for staple goods has been a great help for our community. I would like to see the distribution process organized in a manner that ensures more equitable allocation of goods so that different Molokai families can receive the limited supplies provided each time, particularly our frontline workers and emergency responders. I have shared that challenges with the administration and my willingness to help organize that effort. When the pandemic first hit, our handful of unsheltered community members did not have anywhere safe to go. My office advocated for using a county park as a safe zone since it's closed to the public anyway. This is something I would like to continue to work with the mayor's office. When Molokai has had past positive cases, community spread was substantially reduced because gathering has been minimal. Like anywhere else, one small gathering with someone who has the virus will likely mean several others may have contracted it too. Thankfully, of the 23 or 24 people who have tested positive, only one person needed hospitalization. I am grateful that our Molokai community has been willing to continue to make such immense sacrifices to keep each other safe, particularly those most susceptible, such as our kupuna and immunocompromised loved ones. Our Molokai community continues to keep safe now by diligently wearing masks, washing our hands, and limiting our gatherings. We also have had limited or minimal contact with visitor arrivals and much less contact with outside travelers than Maui has had to cope with. I think the main criticism from our community would most likely be the need for increased communication, more specific to each island's unique situation throughout the pandemic. For example, it took the Department of Health about 7 months to incorporate the community's request of separating Molokai's numbers from Maui County so that our population could more accurately understand our circumstances. We received great news today that the Department of Health has begun administration of the first set of vaccines on Molokai, which is set up in tiers. The first tier are healthcare and frontline workers. Second, those 75 years old or older. Third tier, all essential workers, including employees at the Department of Education. And the fourth tier, those who are 65 years and older. There are 200 vaccines in this first round that would be administered by Friday. All interested people had to fill out a registration form to ensure that they were not at risk of reactions. Once the form was approved, they were put on a list according to the tiers. Department of Health says that they have well over 200 people who have completed the registration on Molokai. Those not getting the vaccine in this first round will be prioritized in the next round. We do not have the date for that second round. The vaccine is a 2-part dosage, so the next dosage for those who are vaccinated at this time will be arriving shortly after the confirmation of the completed 200 vaccinations on Friday, January 15th. The Department of Health advises that anyone interested in applying for the vaccine can register by going to the Molokai Department of Health office or can call them for more information at 808-553-7870. Mahalo again for this opportunity to share updates and perspectives from Molokai. I'm so grateful to those that continue to be on the front line to address the many needs of our community during this time. So many have stepped up, playing a critical role to help each other to get through this. Mahalo again, Councilmember King, and everyone who has or will contribute to educating our community today. Aloha.
Representative Tina Wildberger is here with us, and she is our South Maui representative from McKenna to North Kihei. I think I live about a stone's throw from where your district ends. It's split down the street on Ohukai. So Representative Wildberger is going to share with us sort of the the response that the state legislature will have for COVID and what accommodations they're making for people testifying on different bills. And then you also had a few words about the school system and something about the CARES Act package that we're likely to see coming down from the feds. Take it away.
Yep. Thank you so much, Tina Weilberger, South Maui State House Rep for Kihei, Wailea, McKenna. I want to thank Councilmember King for asking me to join here today. And I just want to shout everybody out who has been struggling and working and coping and taking care of their kids and trying to work and Zoom for the last 10 months, 11 months. We're almost coming up on a year. This has been super hard. And our challenge is going to continue, but we're seeing the light at the end of the tunnel. I want to thank Dr. Shea for his vaccine information and for putting up a great program to get everybody vaccinated. And I want to show my appreciation for Mr. O'Neill for his really thoughtful and deliberative and honest assessments of what we actually have going on here. We're all trying to do the best we can to serve our communities. And you can't please all the people all the time, but that's not why we got into this job. But I have a PowerPoint to share. So if Axel can give me a sharing ability, I'm going to attempt to share my screen, which is advanced zooming. Please stand by. Can everybody see my screen? Can people hear me? No, you can't see it? Okay, I don't think I did it right. Let me try again.
I think Steve can see it, but the rest of it can't.
Wait, Steve could see it, but not everybody else? Okay, screen. I'm going to share. I'm sharing screen. I'm sharing screen.
Yes, a picture.
Start broadcast. Okay. And I'm going to go back to, okay, how about now?
Oh, now
I'm sharing as I am. Okay. This is how you can contact me, Rep. Weilberger at capital.hawaii.gov, capital with an O, and our phone number for the office. So please, if my office can be of any assistance to you, we've been helping people with mostly unemployment struggles, and we're happy to continue to help anyone who needs assistance or links or help or information. I'd like to point out that there's a very short window for a brand new state rental relief program. Today is the 11th, so you have tomorrow and the day after to apply. Please go to catholiccharities.org. It's a $6 million program. Their cap is at $1,500 per month. They're giving 2 months of assistance, and a minimum 6 month of a lease is required. You have to qualify for certain HUD medium income criteria, but please go there if you need some help with rental assistance. This is a short interval for applications, so I wanted to be sure to share that today. Here is the statewide curve. We currently have Oahu state legislators proposing legislation to standardize our travel rules to make it easier and less complicated and confusing for mainland travelers and the airlines and the tour groups. This has been pushed very hard by major corporations like United Airlines, Hawaiian Airlines, and major hoteliers that obviously it's difficult. But if you look at Maui's curve, we are on an incline that looks like Mount Everest. And I think even if you take out harbor lights, we're still on a very dangerous trend. So I'm on team public health. I'm not on team cull the herd. And so I really think that we need to protect our county autonomy. I had a conversation with Kelly after I made a post on Facebook going, I'm watching Kauai and Maui are very similar. We're sister counties. We attract a lot of tourism per capita. And when Kauai shut down, what did we see happen on Maui? Every single person that was going to go to Kauai said, "Oop, nope, don't want to do their 14-day quarantine, but we can go to Maui and not quarantine. So let's all go there." So now what are we seeing? We're seeing a disproportionate number of travelers compared to population coming to Maui and going to Kihei and Lahaina. And what do we have? We have spiking numbers. I refute the data, the assertion that the data says that our transmission is not travel related. The virus doesn't move, people move. And so any of the variants that are going to come in by people on airplanes, whether it's a traveler or a visitor, doesn't matter. The virus spreads when people move. I've been getting a lot of calls from our schools, about our schools, not from the schools, but about our schools. Currently, Kihei Charter School has switched to distance learning as of today on the recommendation of the Lieutenant Governor's do not gather for 2 weeks suggestion. Lokalani Intermediate was going to start distance learning, not my slide is incorrect. I found out after it was made. They're going to start distance learning on the 19th for, I think, a period of 2 weeks until February 1st. However, I've learned that they are exempting any parent who applies to have their child put into Group C, which is the supposed to be the special education designation. And any parents that want their kids to go ahead and go to Lokalani, they can send their kids to Lokalani if they contact the principal and ask for permission. So I find it very surprising that our Department of Education, a state agency, is able to operate so autonomously and almost as if they're their own planet. I don't think that they've been terribly forthcoming with their intentions. I understand that a lot of parents want their kids in school and everybody wants to get back to normal, and it's very hard to have your children at home and try to work and Zoom and all of the things that we have to do. But I feel like we need to have the schools cooperating with whatever the rest of the community is doing. So we have our schools going to take a break, but then they're going to go back into a blended learning and changing classes. So Lokalani did have a case 2 weeks before the winter break. They only had one case, and hopefully they'll be able to keep their cases under control. I wanted to plug the Aloha Safe app. I have it on my phone. It's been on my phone for a couple of weeks. It's only as good as many people that actually put it on their phones. So go ahead and download Aloha Safe. If you're using Google Maps or you're using Facebook or you're using any other internet app, please don't be concerned that Aloha Safe is going to steal your life away from you. It's a great contact tracing program, and it's, considering that we're not doing that much contact tracing really, and contact tracing has kind of gotten away from us, it's important to use this tool. If we can get residents to put this on their phone and get the visitors to use it, it will help us gather data on how the virus is transmitting in our community. Governor Ige's latest proclamation through February 14th, so for another month or so, extends our statewide eviction moratorium. It extends and clarifies our statewide mask mandate. On anecdotal observation, I noticed South Maui residents wearing masks when they're out of their home it's a generous estimate of 10%. I am noticing visitors wearing masks more than our local residents. It reduces the mandatory quarantine from 14 days to 10. Safety checks are no longer suspended, meaning your vehicle safeties are not suspended. If your safety check is going to expire, you need to go to the DMV and take care of that. And it also offers information about healthcare personnel and vaccine distribution and administration, which Dr. Shea went over with good detail. I want to talk about the second federal stimulus package, which is coming down the pike now. I think that Catholic Charities program has been seeded with this funding. It's an overall $900 billion package with $600 going to individual adults who earn less than $75,000 a year. Heads of household with less than $112,000 will get 2 times that amount. $600 per dependent child. Unemployment benefits are extended for $300 a week for 11 weeks or until March 14th. We have $285 billion in loans for small business under the PPP program. There were some questions in the chat or on one of the question and answer area, people looking for small business assistance. And this is where you need to go. The PPP program has been extremely successful. It helped my small business. It's helped a lot of small businesses. And the fact that they are forgiving these loans is absolutely invaluable. They are limiting the PPP to smaller companies with 300 employees that have experienced a 25% drop in sales, which is a reasonable figure for what's happening with businesses that aren't just 100% tourism related. It extends, the federal stimulus package extends foreclosure ban until the end of February. It extends evictions through the end of January. There's $25 billion in rental assistance. SNAP has been increased by 15% beginning January 1. $13 billion put into that program. $400 million to support food banks, $175 million to support Kupuna nutrition programs, $7 billion for expanding broadband infrastructure, $3.2 billion to cover monthly internet, and $1 billion for tribal broadband, $12 billion for minority-owned businesses, $70 billion for public health measures, including $20 billion for vaccines, $8 billion for vaccine distribution, $20 billion to help states continue to test and trace, and $35 billion for wind and solar and clean energy projects, which I think was just screw you, Mr. President. We're going to do something green in this 5,000-page bill. And a ban on surprise medical bills, which I'm happy to see. So it's now illegal for hospitals to charge for emergency services by out-of-network doctors. I have a couple COVID recovery bills that I will put for consideration to my colleagues this session. I think one of the biggest issues and challenges with our departments that are in the state are that they have antiquated IT, and 130,000 unemployed people will be terribly aware of that in their attempts to get claims for unemployment or PUA assistance. I'm putting in a bill for economic recovery for restaurants. Our food and beverage industry is by far the largest small business employer for people in Hawaii, and they have not received the amount of support that they should have. I'm also putting my minimum wage bill back in again and calling it essential wages for essential workers. This bill is different from many of the minimum wage bills that have been put forward because it has a robust tip credit for business owners whose employees earn tips. And if you are already earning $20 an hour in tips, then that employer does not need to pay a $15 an hour wage on top of their $20 per hour tips. So there's a graduated tip credit for this bill to help out the small businesses who have tipped workers so that we're paying a living wage and not overburdening our small businesses. And there's a $2 million homestead bankruptcy exemption. In Hawaii, the homestead exemption is only $40,000. And that really is negligible since the median price for a home in Hawaii is around $800,000. Putting forward a bill to raise the homestead exemption to $2 million. So if people, for instance, a small business owner might have a commercial lease that they haven't been paid, that commercial lessor would not be able to come and take that home away from that small business owner who hasn't been able to pay their commercial rent due to no fault of their own. And that's the end of my presentation. I want to say mahalo to Councilmember Kelly King and my co-representative for South Maui, and thank you all so much for your time and attention today. A lot of great questions. Please, if I can help you in any way, email repweilberger@capital.hawaii.gov and feel free to call my office and leave a message. We are working quite a bit remotely, so leave a message and we will get back to you. And I believe I have stopped my screen sharing.
Yep, we're back. Thank you
all so much.
Representative Weilberger. Just great information, and we're going to hopefully follow those bills and support you on that. There's so many questions. I've actually asked one of my staff members to try to summarize because a lot of them are the same questions. So I'm going to start down his list. There are a lot of people who have asked whether non-residents are getting vaccinated here. What is your stance on people getting vaccinated who are from out of state? And also, are we on track to vaccinate our own population before the expiration date of the vaccine? So I guess that would be a Dr. Shea question.
Sure. So the first question, we actually had to ask the state that very question because we do on Maui have a lot of part-time residents. What we were told was that if people have a place that they live here part-time, we were allowed to vaccinate them. We've made the rule that if you can't be here for both doses, we won't vaccinate you. So people who are here on vacation would not be offered vaccine. But if you're here, you're paying taxes, we think it's reasonable. And again, the nationwide goal here is to vaccinate as many people as possible. And it was too difficult to draw lines other than that. So the second question was about expiration dates. I can tell you because we have the ultra cold freezer, we could store vaccine for months, but we're using it so quickly, it's not an issue. So we're not at all worried about, we have not wasted vaccine and we're not going to.
Okay, that's a great point to make. There's a question about, is there a way to get the unsheltered or unhoused population vaccinated? So what would be involved in that?
That's a very good question. And I admit that we haven't approached that yet because we're still working on tiers 1A and 1B. But absolutely, the houseless, the homeless, the unsheltered will be vaccinated. And I would presume that we'll be working closely with Department of Health to achieve that.
Okay, well, maybe we can link you up with Lisa Darcy and she can help you try to figure out a system for that. There's a question here that I also got an email today about, and it's wondering, it's kind of representative of what I've heard from folks working in restaurants, and they wanted to know if they were going to be aligned with in the priority protocol for vaccines with grocery store employees. I don't know.
Yeah, the definition is a little vague and basically says if you're public facing and you have frequent contact with the public and they're at increased risk for exposure to COVID, then you qualify as an essential worker. And I tend to be, again, as Tina had said, like I'm pro public health. So if you meet the definitions, then I'm going to vaccinate you. What that means though is that our tiers are rather large. So again, we just have to work our way through the population.
Okay. And is that something that's being directed by the state, or is each county kind of on their own as far as what they consider, to be like tiers of essential businesses or essential workers?
We are taking our guidance from the state because we want this to be fair statewide. We don't want one county to have, advantage or disadvantage versus another.
Okay. Okay. Fair enough. So this question is for Director Boz, and there are just a lot of repeat questions about how can, what's being done to enforce the mask requirements, and how can we get more signage up in high tourism areas? I know you sort of answered that at one point, but just, the signage issue I think is a really valid question. How can we get more signage up in some of these areas?
Well, we definitely will work, we've put up the signage as soon as people land on Maui and drive out of the airport. We have roadway signs to notify people that masks are required as a state and county mandate. And so if you're here, wear a mask. And again, businesses are required to put signage up. We don't have a lot of staff to drive around to every single business and see, do you have signage up or not? So if you go to a business and they don't have signage up there, it'd be great if you could remind them, hey, do you have your mask required sign? Because that would be really helpful to notify that. We do get tips, and we do act on those tips. There was, in fact, a lot of the times that we've had to either cite businesses or issue citations to business owners have been based on tips. Different people. There was one business that were required that you didn't wear a mask, and so we actually had that report. We sent our police department out there and took care of that, and they did issue citations to everybody that was there. So it is really unfortunately we don't have the manpower to do everything as far as enforcement goes, and really calling upon the public to be able to assist us. And we'll work on, Mayor and I were actually just talking about this over the weekend, maybe a Aloha task force that we could help get community members out there, Aloha ambassadors. We haven't figured out a name yet for them, but to make sure, to get out there and help remind people that these are the rules that the county has, and please stick to those rules. And the more people we can get involved in that and get out to spread the word out there, the better. Again, we don't want to create situations where there's conflict, but we do want to make sure that people are there reminded of that. And so for those of you who are out there that see things, if you can gently remind people, if there's situations that are habitual or gross violations, please let us know, and we can issue, go follow up on those things. And you can call the mayor's office at 270-7855 and let us know. We prefer you don't just call 50 times for every single person that you see. Please, if you're out there and you're concerned about it, please let them know, and we'll do our best to do that. But signage is really the only thing that we have right now. I don't think bullhorns or flying over with airplanes, with those kind of announcements. Other ways to get mass messages out there. But it's really something that we can try. We can work on other communication tactics as well. We are working on some messaging on TV and getting into the hotels. They have their own cable systems generally at the hotels. So if we can get PSAs in there as well, that's going to be beneficial. So.
Okay, thank you for that. And maybe Steve, can you maybe give us? Is there anything being done on Kauai as far as mask enforcement, quarantine enforcement that you can share with us?
Well, we did notice that, just as a citizen on Kauai, we did notice that they're quite strict about the quarantine. It's a smaller, island, so it's easier. But they do send National Guard or police to as far as we can tell, every house, every time there is somebody quarantining every day. And that's, and then they obviously occasionally do some arrests, which they make fairly public. So that I think makes people take it quite seriously.
Okay, so is any of that happening here, Director Boz? And we've gotten a lot of questions about how quarantine is being enforced as well, because, if you send somebody into a household of 5 or 6 people, presumably all those other people would need to quarantine as well. So can you just, tell us how the county is enforcing quarantine?
So we are utilizing the Aloha Safe application check-in method for first wave. So people, if you are required to quarantine, you have to check in with the application every single day. And if you don't check in, our police department will follow up. Unfortunately, we don't have the staff that Kauai has, and they have a lot less people in quarantine. So we do it based on complaints, and we appreciate, like your neighbor mentioned, if you see this person out there, call the neighbor or, call the police. We do react to that. I know probably not as much as people would like us to, but we try our best to get out there. And again, we have increased our police force specifically for quarantine and mask enforcement in those areas. And I really want to take a shout out to the police department right now. And we have a special team that really, they work day and night. They have an email address that you can email mpdquarantine@mpd.net. And, they check that very frequently. They follow up. We have staff that go before and after work hours to do specific mask enforcement, and they do really the best job that they can. But it's got to be a community effort. It can't just be a law enforcement.
Great. Thank you, Director Boz. I think it's important, though, to have the channels where, businesses or areas where there are repeat offenders that don't wear the mask, we can call and report it, because it is very uncomfortable for people to approach other people on the street and tell them, hey, put your mask on. That's a difficult task you're asking of us. We have one question, Dr. Shea, about how many who have registered for the vaccine are in the queue. Do we have a line forming?
I can tell you, we vaccinated 850 over the weekend. I believe we have approximately 1,000 people currently who have appointments, and there's about 6,000 people that we have in our registration who have not yet received vaccine. We've been talking with Hilton Rathel about getting us, we have at least 2 trays of vaccine, which are approximately 1,000 doses each, coming this week. We're trying to get a third, and then we're on par for 3 more trays next week. So again, we are trying to get as many doses here as we can. Obviously, there's high demand on Oahu as well, and that's our primary competitor for doses right now.
Okay. And here's another good question. Do both vaccines address the hybrid COVID-19 virus?
So by the hybrid virus, I presume they mean the new variants that we've been seeing in UK and out of South Africa. What we're reading right now is yes, but I think because they haven't specifically been tested with people who have that virus, that strain, we don't know 100%, but the mutations to the spike protein have been small, and currently the science, the opinion is that it will be effective.
Okay, well, that's good news. I know we're running out of time, and if you folks are willing to stay on a few more minutes, I think we're still going through some frequently asked questions, but I also wanted to bring on Kara Flores, who is with the Hale Hawaii group that's been kind of like the citizens group, I think, that Steve O'Neill was talking about on Kauai. And they've got groups on every island that they're working with. Kara, if you're there, we'll have Axel unmute you. And I wanted to let Kara just talk a little bit about the reasons that her group and others that joined them came to me promoting the idea of the task force. And if we still feel like, just maybe you can say a few words of whether the groups still feel like we need a multi-stakeholder task force.
Yes. Can you hear me?
Yeah, aloha. And maybe you could just give this quick background of your group.
Okay. Our group started actually with the COVID-19 facts group, and that group of us wanted to do more and wanted to do it on a statewide level. So that's how Hale Hawaii actually came to be. And the task force was an idea that came when we realized the reopening was happening and there wasn't going to be a second test, and kind of like, well, what do we do now? Because we expected this to happen. We expected that our cases would quickly increase and that we would get community spread, unfortunately, like that would get into the community. And that was based on some data actually out of Kauai, some of the doctors who've been working together in Kauai. And so looking at that, we researched what's worked in other places. And also with talking with Steve O'Neill, we realized there's all these great minds on the ground, just everyday people who are brilliant, who want to contribute, epidemiologists and stuff we've been working with in the state. We have all these county council members who the people elected in this very recent election. So these are the people the community put their trust in to help with our county. And then we have our state representatives, many of who just got reelected again. And so we thought, what better way? What we're seeing, the problem we're seeing still is there's a communication gap and just an inefficiency between the people on the ground who want to do something, the county level government, and the state government. So we thought, what if we could get our county to work together as a team and utilize all these people who want to help and all these council members who really care, and we could put together under the authority of the mayor. You know, the mayor has obviously more power than any citizen or the council, things on a countywide level, but then also we could have the state representatives, which would bridge the gap between the county and the state. And so the state representative could take things to the state. If there's legislation that our county needs specific to COVID and this crisis, that would be a way that we could bridge that gap and kind of hopefully reach all the way up the top of the ivory tower to EGAY if needed. And so, you know, we brought that to the counties, and obviously we're in Maui County, so we wanted to get something like that implemented here. And so one of our members who is a lawyer in another state, she helped write the resolution and come up with this idea. But we thought, you know, utilizing a contact tracing app, quarantine enforcement, mask mandates, and actually the mask ordinance, we're hoping to get like a countywide mask ordinance, so there'd be a flat fine for someone who's not wearing a mask. Because when talking to law enforcement and other people higher up, the issue is right now the mask ticket is a criminal offense. It's a misdemeanor, and it has a potentially huge fine. And so law enforcement don't want to penalize people that severely for something so minor. So making it more like a traffic ticket that's $100 or $50 is a lot more effective, because people don't want to deal with fighting it and they'll just pay it. So it would create revenue and increase compliance. You know, helping put signs around, you know, official signs from the county to let people know they are expected to wear a mask when they're outdoors, especially like on Front Street, the Wailea Walk area, Kihei Triangle, anywhere where people congregate and walk a lot and are together and are less likely to be able to space apart and stay, you know, 10, 20 feet apart, just to have signage there so that you don't have to tell someone, put on your mask, please, because I just did the other day and they got mad. But you could just point to the sign and kind of like point to your mask and be like, hey, look, you know, like this is how we do it here. And so these are just like really simple things that people are constantly commenting on or texting on in groups and reaching out with, that, you know, if we could get them in front of the people who can make them happen on a regular basis, they could get implemented. And there's people who are more than willing to help go do it. And so, you know, we think it could be a way for our county to communicate all the way up to the state level, our citizens to communicate more directly and freely with our mayor and our county council. And it would really just bridge a lot of gaps that people are seeing and make us a little bit more efficient in dealing with this, and hopefully, you know, reducing our cases and getting more people to comply and all do the right thing. Because I do think most people want to do the right thing. So this would just be a way to help enable people to do more and contribute more and make our community better. Because I think a lot of people would like to do that. So,
yeah, thank you so much.
Yeah.
Thank you for all your involvement. Just wanted to share with everybody that the resolution that was passed unanimously by the previous council term, which ended December 31st, it says the makeup of the task force would include the managing director, at least 2 council members, at least 1 state legislator, Dr. Lauren Pang, from the Department of Health, State of Hawaii, and at least 3 additional residents with relevant expertise. So that was in the original resolution. and thank you for your assistance with that, Ms. Flores. So we're a little bit past the top of the hour, which we're supposed to be ending by, and I really wanted to thank everybody for showing up. If you're willing to stay for just a few more minutes, I wanted to have my staff member kind of run down the list of some of the solutions that have been talked about today. And, I don't know if this will help you, Director Boz, or if maybe an idea could be to put out a questionnaire as far as what the biggest concerns are. But I just wanted to share some of because I've had people contact me about, about the priorities and whether, hotel workers are on the same par with restaurant workers and the same par with grocery store workers. And there were solutions offered. And there were also other things like putting temperature, one of those temperature machines where you walk up and do it and just put your forehead and, in every county facility and things like that. So Michelle's been monitoring the chat and the Q&A and just kind of, I just wanted to run down a list of potential solutions that members of our community are citing. And, and this is not meant to put you on the spot or anything. I just want to give everybody a voice to express their concerns about things that they think should be happening.
I also, if you don't mind, I wanted to give you the everybody listening an update of what the mayor's proposed rule changes that he had sent in to the governor on Friday. We still haven't gotten approval yet, but he did want me to share that with the community as well. So I can go over that.
Okay, let's let Michelle go over just a quick rundown of the list of things, and then we'll end with you, Director Boz, talking about what the new rules are. Michelle?
Thank you, Council Member. Some suggestions this evening are test upon arrival and retest at specific intervals. A way to sign up and get alerts for vaccine stages. An app similar to the app for reporting what used to be the cane birding violations, where people could report areas of people without masks. Upload pictures of mask violators in public. Signs at public places like parks and beaches to remind about masking up. Provide free gloves at gas stations and grocery stores. Require visitors to download Aloha Safe Alert app as a part of the Safe Travel program and their approval to be released at the airport. Request for a link to help homeless with goods or cash, which we provided, shareyourmana.org. Create Aloha Safe ambassadors. Hire unemployed to staff COVID response, informing public of the rules and rule enforcement. So the idea on the Aloha Safe Ambassador was a t-shirt or some sort of shirt that those volunteers or employed members wear who are at high population areas in our county, grocery stores, public places, malls, etc., who are then empowered to go up to unmasked people and provide some reminders. That's it for our list this evening.
Okay, great. Thank you, Michelle. And, I just wanted to mention too that one of the things that we didn't discuss was personal responsibility. And so, we each have the personal responsibility of wearing a mask, wearing gloves if necessary, washing our hands and keeping our workspaces clean and things like that. Somebody that I was speaking to over the last couple of weeks mentioned too that eyeglasses, whether it's goggles or regular glasses or sunglasses, are also an additional help because a lot of the airborne germs can pass through your eyes. So I'm not sure if that's something that's on the radar, but I was told that people who wear glasses, there's less percentage of incidences. So I was hoping to get a doctor to talk to us about those kinds of things, and also immune system boosters, because that's really important too. The reaction you get to COVID has a lot to do with how healthy you are. And so there are also things that we can do to boost our own immune systems with vitamin C, vitamin D. Zinc is supposed to be a good one, but that, we could have had probably 5 additional discussions, and there's just not enough time. I really appreciate everybody's input. And Sandy, if you want to give us that report of what the new rules are based on, I guess, as of today, hot off the press.
Well, again, we've requested the governor. We sent in the request to the governor on Friday. He hasn't approved it yet. We've been kind of going back and forth with the Attorney General's office on some clarifying on why we wanted to do certain things. We hope to get approval tomorrow, and it would be effective on January 19th. What we're doing is, there's been concern about the volume of people that go into large retail locations. And so we have put in a request to the governor to limit the large retail locations to 30% of their occupancy. The Costco's and Targets and Walmarts and Lowe's and Home Depot, those kind of things, to limit them 30% of their maximum occupancy load. And for small mom and pop type businesses, 50% of their occupancy. It's kind of a little bit comparable to restaurants. The thing with restaurants are that you're sitting there for a long period of time, without your mask on. Whereas retail, you're generally in and out pretty quickly. And but there is, I'm sure you guys have been to Costco, and there's a large volume of people. So it's something we wanted to make sure that. And I personally talked to the managers of the stores. And let them know that, we are very concerned about this. They were all very, very open and comfortable in working with us on different restrictions. But that's part of it.
Director Boz, you sent me a note about the CDC. There's a guideline that it takes 15 minutes to be in the same proximity with somebody.
Yes. The general guidelines for a close contact definition is that you're within 6 feet of somebody for 15 minutes or more. And that's the general definition that they utilize as a close contact. So when contact tracers evaluate whether or not somebody is more at risk of contracting COVID from being around somebody who was positive, that's really the guidelines that they look for. The other rule changes that we are looking at and proposed was to travelers coming in, even though they've tested negative and they're being screened at our airport, we would want we would mandate them to download either the Aloha Safe Alert application itself or some other GAIN application, so that when they arrive, they show it to the screeners to say, hey, yeah, we have this downloaded, and leave it on their phones. I mean, there's no way that we can enforce it everywhere, but just, as they come through, to make sure it's on their system and that they're utilizing that same type of contact tracing as well, so that, it is there. So that's one of them. Also, there's a kind of a issue with worker exemptions. We have critical infrastructure workers that come into Maui on a regular basis, going to Oahu and other areas. So if a critical infrastructure worker is going to be here for just that day or overnight, then they'll be able to still get the same exemption that's in place now, and download the Aloha Safe Alert app. If they are going to be staying here longer than the overnight 24-hour period, then we would also require them to test before they come, and basically, making them participate in the Safe Travels program. The governor they have some other proposals that they've been discussing, but this is what our proposal was that we put in for the governor. So those are the main things. There's some tweaks here and there to some of the other rules, but those are the main big changes that we looked at sending up to the governor, and hopefully, like I said, we can get approval tomorrow.
Okay, if we had approval tomorrow, those will start tomorrow?
No, they'll start on January 19th. We wanted to give businesses especially the time to prepare their business, to understand, how they're going to do the counting and figuring out what their 50% is and things like that. It's pretty interesting talking to the managers of the different stores and how they do it. When you go into Costco, you see somebody with a clicker that's checking every person that's coming in, and they keep a count, and they allow only a certain number in per hour. Actually, I think it's per half an hour. And then Target you don't even see somebody because they have an electronic counter. As soon as a body comes through that main entrance there at Target, that gets counted, and they have an electronic counter that also counts the people outgoing, so they know exactly how many people are in the store at any given moment, so they can put that in place. But yeah, no, there's different ways. We want to give them some time to get others to get into that.
Well, I'd like to give a shout out to Maui Coast Hotel because I've only probably been out to eat about 5 times in the last 8 months. And when I went there, because it's open air, they actually had a book where they made you write your name down and your phone number and the time you came in. And I thought that was great. So just a shout out. And I did get a text that Steve has some suggestions for us for reopening schools and that you want to share with us.
Well, I'll do that real quickly. And yeah, I'm sorry my presentation was so heavily focused on sort of traveling inward. But our efforts on Kauai have obviously been to try to prevent community spread in the first place. I have kids that were in 3 classrooms with enclosed ventilation maybe on one side at most, and then masks off. And that we think is the kind of thing that could create a super spreader event. So we really recommend, and I promised some folks I would bring that up today to really think about that. The DOE just doesn't seem to be able to change that. But if I think, I don't think people would, if the schools are educated, I don't think people would object. So thank you.
Great, thank you. Yeah, and I know it's been a real concern for the teachers union. I've actually spoken to the head of the Maui Teachers Union, HSTA, and the teachers have a very big concern. So it's not just the kids giving it to each other, it's the adults that are in the room as well. So thank you for that information and that suggestion. And, we have over 100 questions here, and I think we probably addressed maybe less than half of them. Some of them are repeat questions. So I'm going to have my staff try to consolidate these. And if you folks don't mind, I might send you some of these questions. But I think it's really important to have regular conversations where we're telling people what we're doing and how decisions are being made, where we're likely to go. And because I think why we're doing certain things is just as important to people as what we're doing. It's very uncomfortable for the general public to see these rule changes without knowing why they happened. And some people, they don't make a lot of sense to some people. And so I just so appreciate all of you for coming on and giving us more information that we can assimilate and understand, okay, this is why this is happening. And then also allowing us to make suggestions and people to make suggestions through the Q&A in the chat for what they would like to see to reach a higher comfort level. And it's going to be an ongoing debate between, I think there's 2 main schools of thought. One is that the tourists are super spreaders, and one is that our resident social gatherings are super spreaders. And it's going to be, I think it's hard to tell because when we do free testing for residents, we get a lot of people coming. We're not able to test tourists, I think, in the same percentage because we can't force them to take a test at this point when they get off the plane. So that's hard to assimilate that information. But there's also a debate about whether it's more harmful, and looking at these questions, whether it's more harmful to shut down everything and have people be in distress versus risking everybody's lives and health. And so that's an ongoing debate as well. I happen to think that that health and people's lives are of utmost importance and come first. But I do understand the economics of what's happening. So thank you for sharing what's likely to come down, Representative Weilberger, from the feds, because we really need that assistance to help get us through so we can enact these stricter guidelines and mandates and still survive while we're doing that. That money is going to be critical. And I believe I heard that Hawaii's share of that total amount of money was going to be somewhere around $2 billion, maybe a little bit more than that. But of all those billions, we'll be getting maybe $2 billion. So how we spend that is going to be very important. And I appreciate everybody who logged on and who watched. We have I'm going to send you, Dr. Shea, if I can, any other outstanding information about the vaccine. But if you can share with us maybe Axel, if you can put it into the chat box, the information on how to sign up for vaccinations. to get in that queue. That would be really helpful. And I think it was on our flyer. Was it on our flyer, Axel, that went out? Yeah, he's still there. He's pretty busy with the technical issues.
No, Kelly, but we will get it.
Okay, we'll put that on our Facebook, and we can ask everybody else to share that information as well. We'll keep us posted, Dr. Shea, on what's happening with vaccinations for the different tiers of businesses, and also with the homeless community. And we're once again sorry we couldn't get the Molokai video to play, but we'll try to get that information out to everybody as well. And thank you for staying on. It's almost 8:30, and I appreciate everyone's interest. I think this kind of discussion is really valuable to the community, and I hope that we can do this again real soon. I wouldn't expect Representative Wildberger to host it because she's going to be knee deep in the state legislature. I think they're still making you come in person, aren't they? Even though they're allowing virtual testing.
Sadly, 28 states and the Virgin Islands are all operating remotely, entirely remotely. Those are mostly Democratic states, but the all Democratic state of Hawaii can't manage to get their tech together to operate remotely. And so unless I present a doctor's note, I am required to present myself in person, and I make the assertion that I am not sick. I just don't want to get sick or make someone else sick. And so I've been highly critical of the leadership in their insistence that we meet in person. Many of my colleagues are flying and traveling about very regularly. Many of my colleagues cannot keep a mask over their nose. I'm been very vocal about my misgivings and I'm trying to choose my words carefully. My concern for me and my colleagues there. We have many members in the state body who are elderly and vulnerable. And so I'm very concerned about them. My husband has bought me a ICU nurse hood with the filter and the hose and the air that's going to pump all the air. So I'm going to look like a spectacle, and I'm going to keep myself safe. I'm not going to not show up because they're making everybody show up unless you have a doctor's note. And so I feel like we're doing a disservice to everyone in our caucus and the body by not offering remote work, since we have the technology and the capability of doing all of our functions remotely. But so we're going to do, I didn't talk about this. We're going to have remote testimony, however. So finally, neighbor islands will be on a level playing field with testimony for the upcoming session and bills. So all of the committee committee hearings are going to be online on Zoom. Everyone needs to sign up on the website for the state capitol. You cannot email testimony to committees anymore. You can testify in person on Zoom and make that choice. So everyone who's interested in supporting bills throughout the legislative session, this session, please make sure you're all signed up with at the capitol.gov website as a user, and you'll be able to submit testimony and present on Zoom testimony, which will be curtailed and limited to maybe 2 minutes. Thanks.
Thank you. And we'll look on your Facebook page for that information if we need it. Thank you so much. And thank you for your advocacy for that, because I know that you are a key voice in making that happen. There's also a bill for folks. You should know that there's a bill that Maui County and all the counties are supporting, as well as the Common Cause folks, I believe, to allow testimony, to allow meetings to continue to happen remotely and testimony to be taken remotely, so that councils like Maui County Council can continue operating and allowing you folks the ease of testifying from your living room, from wherever you're calling in from, and whether or not we have COVID. So we've just found that people have been so much more engaged and so much more willing to come forward and testify, and it's much more comfortable and a lot less waiting time. So you don't have to drive down to the chamber and wait for 3 hours for your name to be called. So we're hoping that bill passes, and we'll be talking to our representatives and senators about that as well. And with that, I want to thank everybody who dialed in and who asked these really important questions. And things are changing so rapidly. We'll try to do this again real soon. Really appreciate it. Aloha, everyone. Stay safe. Mask up when you're in public.
I said mask up at the same time. On mute. Take care, everybody. Thanks for your contributions. Aloha.
Well, have a good night, everybody. Mahalo.